You ever feel neck tightness that slowly you find starts to turn into a headache? It may start as stiffness and slowly it starts to build into some more pressure. That's incredibly common and not random. Today I'll explain why it may be happening to you and what you can do about it starting now. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor, and here we are at One Life Family Chiropractic, our practice in Georgetown, Ontario, Canada. And today I'm going to be talking about cervicogenic headaches. And if you're just tuning in, I love having you and being part of your health journey. So please take a moment, make sure you subscribe and like so we can see more of each other down the road as well. In the big picture, when it comes to cervicogenic headaches, many headaches, well, they originate from the neck. In particular, the upper cervical spine or those first few segments of your neck. Tightness and an improperly moving spine or restriction can sometimes refer pain into the head. So cause number one is often upper neck tension. These few segments at the top through here may not be moving properly, and as well, these muscles may be, well, more tight than they necessarily should be, making these tissues highly sensitive and easily overloaded by poor posture and stress. So that's cause number one, is something to consider. Cause number two, poor posture and screen time. I'm sure you guessed it. Can you imagine what that looks like? Just like this, flexed over. And if you practice this, well, you practice this more and more, you're going to get better at it. So forward head posture, looking down at devices, which produces constant low-level strain, which could be a potential cause of your cervicogenic headaches. Cause number three, lack of movement. You may be sitting for long periods of time, not enough neck and upper back movement, and the system is potentially getting more stiff and more guarded over time. So here's what to do. I want you to first focus on restoring motion. Some simple things that I recommend on the regular are to simply practice this movement right here. What I want you to do is think about full ranges of motion in your neck. And if you're sitting right now, practice this. So I want you to think about the letter X. This is the simplest way to start, 8 to 10 times this way, and then 8 to 10 times this way. As you practice that, I would do multiple times throughout the day. What I would also add in is just do the eye tracking exercise with the thumb. And what I do is put my thumb out just like this. And remember, you want to use your eyes to help increase that range of motion in your cervical spine just a little bit more. So what I'll do is 5 to 6 times like this. And I'm focused on moving into ranges, getting right to that end range, looking up into extension, and then coming back down. And really using my eye movements to just get a little bit more motion out of my neck. So I'll do 5 to 6 on that arm, and then I'll do 5 to 6 on this side. Again, involving getting your upper body moving out of that slouch position and getting your head to rotate and extend and helping to maintain those ranges of motion so you potentially don't get so tight and guarded down the road. Number two, in terms of what you can do, is first of all, bring all your devices up to eye level. Yes, your computer, even if you have your phone in your hand, I want you to bring it up like this. You can operate your phone just fine like this. And instead of being craned down, that's helping take tension off right away. And break up your screen time. Instead of being sitting for 2 to 5 hours at a time in the morning, get up every 20 to 30 minutes, move around. And if you brought the devices up to eye level, make a point of investing in yourself. Invest in a standing desk to bring everything up so you're not constantly flexed forward and practicing that bad habit. And number three is you can actually do some of your own soft tissue work. Is you have a set of small muscles that come up through here, and they're very much shaped like a diamond. What you can do is just gently place your index or your middle finger on these tissues here and put them through a range of motion. So what you can do is find this C2, it's going to be the most protruding spinous, just as you fall off your skull. And then what you're going to do is just drop off to the side of it and up. So I'll drop off just like this. And if I'm on my left side, I'll look up to my left side, and then I'll look down to my right side. Now, keeping in mind, I'll do this 6 to 8 times with some passes. But what you'll do, you don't need that much pressure. You just need enough in terms of skin slack, or you can even think about it as how would you check the ripeness of a tomato? Push the pressure down, 4 to 5 kilograms of pressure, and you're going to go through those ranges of motion. You can do this side, and you can do the same thing with the opposite side. So same diamond-shaped muscles through here, and you're going to find the most protuberant spinous, and then go off to the side and go slightly up. And with this side, look up to the right and look down to the left. Again, through a cycle of 6 to 8 times. Finally, you're going to help build support in terms of what you can do on your own. keep a simple band like this at your desk. And I want you to think about, well, working on areas downstream as well. And with this, what I'm going to do is just bring my shoulder blades down and back, and I'm going to do what's called the W hold. So I'm going to pause for 4 to 5 seconds and then relax. I'm going to do that 5 times. Thinking about strengthening your upper back muscles, your external rotators, and building on some support so that you're not constantly making all these muscles shorter and more tight from sitting flexed forward. You're now opening up and training the upper back muscles. Simple band you can get to keep at your desk so you can do on your own while at work. Now, some of the reasons why this can work for you. First of all, you're going to help reduce some tension and improve the way you move and break up those bad habits that you've picked up throughout the day. And the simple act of you moving and changing your routine can really help just calm your nervous system rather than being so tense and guarded and focused on your screen time sitting flexed forward. And of course, something very important to consider in the X factor, because many people will come to me and they've tried all these other things, is just addressing the health of your spine and nervous system. Remember, if your spine doesn't move properly and your nerves are potentially irritated, that's what your corrective chiropractor is going to be looking for. So you'll see up here in this picture, those small muscles are tense, those joints don't move properly, and what you want to do, well, is actually restore motion and improve that brain-body communication, which is really the focus on corrective chiropractic. And the only way to know is to get tested to know what's going on the inside. And that's why I recommend finding a chiropractor near you. So guess what? You can potentially bounce back quicker and get a better result faster. So consider addressing the health of your spine and nervous system so you can get more out of your body. And this is a really important piece of the puzzle that many people tend to overlook. So it's really important to address this piece of the puzzle, and it's often the X factor that helps get you over the hump, reviving your capacity to heal that much better and get you back on track sooner. Anyways, loved having you today. And remember, follow the simple stepwise progression to help yourself get back on track, especially if you notice some of these challenges and you may be experiencing cervicogenic headaches. These are simple things that you can do on your own to help break up the day and improve your overall health. As we sign off today, remember, take a moment. I'd love to be a part of your health journey some more. So take a moment, make sure you subscribe and like. I'd love to see more of you and help you out in the future. And remember, you're far stronger, more resilient, and resourceful than you may have been led to believe. Bye for now.